At the Royal Victoria Hospital in Belfast, there's one particularly busy clinic where patients queue from early morning before the doors even open. It treats more than 10,000 patients a year, and every year the number's growing. It's the clinic dealing with sexually transmitted infections.
I went down myself and of course was crying hysterically and was just in so much pain and discomfort, and basically couldn't believe that this had happened to me.
Herpes is like luggage you carry forever. So you could have it and it might not come up for 3 years, 2 years. There's no time limit.
The Pox Doc, the Clap Clinic, the Dick Doctor. Officially, it's the genitourinary medicine department, the Gum Clinic, the clinic no one wants to admit going to, the subject of jokes, a source of embarrassment, even shame. Consultant Raymond Moore has been a Pox Doc here for 34 years and is internationally recognised as an expert in sexually transmitted infections.
This is the entrance into the male section of the clinic. I think the first thing you need to know about this clinic was it was never custom designed. It's grown like Topsy. It's like a maze. It just doesn't really work very well, but it's all we've got. The clinic's called a genitourinary medicine clinic, and I suppose we could say it acts as a sort of sexual health casualty department. All the seats would be full on a very busy day. I think you had to see this clinic before we changed the system. Because we got to the point where there were people just standing all over the place because we used to have an open door, open access policy seen on the day you turn up, and that just became impractical because of the demands on the service. When I first started in this department in 1976, we would have had 1,600 new patients a year. We, a couple of years ago, peaked at over 7,000 new patients, plus another 4,000 or 5,000 return sort of new situations. And we haven't got that much more in terms of staffing or facilities. Just these open doors here are consultation rooms with examination couches, computers, desks, facilities for taking samples, etc., etc. Most of what you will see here is not life-threatening, but they threaten people's lives. The tragedy is often they're quite minor problems, and they have spent years, some cases, of their lives really wasted. They don't, it affects every aspect of their life, their socialisation, their ability to form relationships, etc., and makes them very unhappy people.
Such are the attitudes to sexually transmitted infections. It's the one area of health most patients just don't want to talk about. Despite several months researching this programme, we could find only a few willing to share their experiences face to face.
One day I woke up and was in a lot of pain in my vagina. It's a blur to me, to be honest. I must have felt every emotion in the world. Afraid, embarrassed, ashamed, even though I'd only been with this one guy.
I could have put a spacesuit on and hid in it. You know, you don't want to be there. And you got these wee boys on the phone. On the mobile phone to their friends. Yeah. I'm in the dick clinic. And you're just going, what the fuck?
Even when an infection's caused by diabetes rather than sexual contact, a patient can still feel that embarrassment.
You walk into an Richard and Judy on TV, everybody reading the magazines but not reading the magazines, and you're sort of sitting there and you're holding it, goes, hope I don't see anybody know, hope I don't see anybody know. It's a fairly unusual experience, I think, because
It's compounding two things which really don't go together, you know, sex and somebody taking a really close look at your private parts, you know, in the least sexual way possible.
There is a very common misperception that all we deal with is sexually transmitted infections. And that's a problem for some people because it means they're reluctant to come here. They don't want to be seen to be attending a sexually transmitted infection clinic, when in fact that's not the case. I think we all know Northern Ireland is a society that has got its own particular aspects. People aren't comfortable with sex and sexual matters, and that stems as much from the prevailing cultural attitude right through to the education system, through to the attitudes of religious bodies, etc., which I don't feel adds up to a healthy picture to allow people to enjoy a healthy sex life.
Marissa Boyle believes no one should be embarrassed about going to the gum clinic, but should treat it like any other medical appointment. She's happily married and has no reason to think she might have an STI. She's volunteered to let us see what happens.
It's Monday morning, 8 a.m, and I've come along to the Belfast Gum Clinic. No, I felt it was very important to come along today. I've always worked in the healthcare environment, and I think it's very important to be responsible about your sexual health.
Morning, Marissa. I'm Dr. Raymond Maw. What's the problem you've come up with today?
I just really wanted to come for a checkup.
Okay. Have you had any worrying symptoms around the genitals?
No, not
no
recently.
abnormal discharges or no skin problems around there?
No.
Now, we take a full sexual history from everyone, and that'll be some intimate details. Is that okay?
Yep, that's fine.
Okay. Are you in a relationship?
Yes.
Of how long now?
12 years.
12 years. And do you use condoms?
No.
Okay. Do you have oral sex with each other?
Yes. Yep.
Sex, the back passage in sex?
These are questions every patient is asked before examination.
Besides your husband, when did you last have sex with anyone else?
It helps Raymond understand if there are any particular risks in their sexual behaviour.
Okay, let's see. Okay, in your lifetime, how many persons would you have had sex with?
Across the hall in the male clinic, the same pattern of questions is followed.
Any problems? Had any pregnancies?
2.
2. And 2 children?
2 children.
And when was the last one?
10 weeks ago.
Great. It all went well?
Everything was perfect, thank you.
Great. Well, look, that's all the questions. What we do now is pass you through to the nurses who'll get you up on the couch. You've had examinations before, obviously. So it'll just be like, say, having a smear done. We'll then do some blood tests for syphilis and HIV we recommend everyone to have. And then if everything looks okay today, there's actually nothing more we need to do today. Okay. We only contact you if any problems arise out of the test results. Okay. And if you don't hear from us within 2 weeks of today, you'll know that all your tests are fine.
Okay.
Sexually transmitted infections are not discriminating. There are some surprising names among those who've suffered. Anyone who's sexually active is at risk. But not all patients come to the gum clinic because of infection. There can be other reasons. Wallace Dinsmore is an expert in sexual dysfunction.
When I became a consultant over 20 years ago, there was a lot of material published about the treatment of erectile dysfunction, but at that time there wasn't any regular erectile dysfunction clinic. So I set one up in Belfast, let the local GPs know about it, and very quickly there were a large number of patients arrived, 40 or 50 per week on a Monday afternoon. At that time it was with injections into the side of the penis. That might sound horrible, but despite that, people were very anxious to get treatment. Then Pfizer discovered Viagra. Luckily Belfast was one of the places selected. And we had hundreds of patients on those early trials between 1994 and 1997. So Belfast truly was one of the first places where Viagra was tested. This demonstrates the average time from erection to ejaculation, which in most men is 4 to 5 minutes from penetration to ejaculation. There are other sexual dysfunctions which perhaps aren't recognised as much, such as premature ejaculation. I quite often get men up saying, "I've got premature ejaculation, doctor," and you ask them about it and you discover they're actually quite normal. It's their partner's got excessive demands. There are a significant number of men with premature ejaculation, at least 1 in 10, perhaps even more than that. It depends on the definition. The commonly used definition of premature ejaculation at the minute is ejaculation less than a minute after penetration. It can be very distressing. Relationships break up. There are a lot of quite serious depressions, etc., develop from it, and again, that can be quite simply treated. And again, we were very lucky in Belfast to be involved in a number of new treatments for this condition. There are new tablets and a new spray which made headlines about 1.5 years ago, which it was a spray for premature ejaculation. It made men last 7 times longer, and the average length of to ejaculation on the spray was 3.5 to 4 minutes. Most people are quite interested in, and you wonder sometimes if the interest is a personal one or not, but it's certainly not a conversation stopper socially, which you might think it would be sometimes.
If you get undressed from the waist down, pop up onto the couch then, cover yourself up with the roll, and then I'll just tell you about what Dr. Ma is going to do.
Okay.
When he comes in, and all about your examination, all right? Every day I get to see young women, older women that come in, they're highly anxious about their predicament, and I feel that I can relieve their anxiety. I give them like a clear, concise description of what is about to happen to them, therefore enabling them to sort of understand it and reduce their level of anxiety during the procedure. Okay, I'll just quickly run down the examination with you. Dr. Ma is going to first check your glands down below. He's checking those to make sure that they're not enlarged. If they were enlarged, that would be indicative of an infection, a severe infection down below. Right. So then he's going to check your vulvar area. He'll check your labia. He's checking for lumps, bumps, warts, inflammation, any moles that would indicate skin cancers, any signs of thrush, infection, or anything that just shouldn't be there, and then he'll give you the speculum examination. Well, I think what we're trying to do really is reduce the stigma. What we want to do is try to normalise it and to say it's okay for you to have sex as long as you pay us a visit as well. Check out that you're not passing anything on, because people may think that there's a stigma attached to it, but the people that are visiting this clinic aren't passing anything around. It's the people that aren't coming are the ones that we have to try to encourage to come.
Now, bring your bottom to the edge of the couch, okay? And then if you could let your legs flop wide apart, that'll mean it'll just be a little bit uncomfortable. Now, I'm just going to examine the whole area of the skin, feel these glands, and look at the skin. Okay. Now, just going to press this inside, just feel a little bit of pressure. And okay. And got your cervix in view. Thank you very much. Okay, just have a little look as we come out. And right, okay, Marissa, that's the examination finished and everything looks fine. I don't think we've anything to worry about here. As I said to you before, if there's any problem that comes out of the test results, we'll contact you by phone within 2 weeks.
Thank you.
That's great, thanks a lot. bulk of the things that we deal with are local genital infections, such as chlamydia infections. We have a lot more of conditions which we thought we'd seen the back of, such as syphilis. We get a lot of herpes now. And there's a list of things that we get. And some of them can be terribly painful in the short period of time, but most of that can be dealt with. Some of them are persistent and can be really troublesome to get rid of, such as genital warts, which in themselves are quite minor, but can really upset people's lives. We've got the obvious big one, of course, we haven't talked about yet, that's HIV. And yes, of course, that is a huge life-threatening problem, but which has been transformed in recent years beyond everyone's hopes. We've had a resurgence of syphilis. If I could give you an example, that in the decade of the 1990s, we probably would have seen less than 10 new cases of infectious syphilis. In the last 5 years, we've seen over 300. So it's a big rise.
I am a biomedical scientist, and what I do here is the doctors will take samples from the patients. The samples are then sent round here. What I can identify here would be yeast, that would be a thrush infection, trichomonas, which is like a wee parasite. On the other slides that we have, that I stain, I can then see bacterial vaginosis for the girls. In the case of the boys, what I'm looking up there is for the presence of pus cells, and if there are enough pus cells there, then that would require treatment. Those are the main things I would be looking for here. The chlamydia I cannot do here, and also the blood tests for HIV, hepatitis screens and syphilis, they all go down to the main lab.
When I was 15, I met a guy. Then he meant the world to me, and I thought that he was the best thing because I'd chosen to lose my virginity to him. One day I woke up and was in a lot of pain. I was shaking that bad. I was crying, crying hysterically like a wee child because I was in that much pain. If I had to go to the toilet, it was so sore. It's a blur to me, to be honest. I don't even know how I knew where to go or had even heard of this place. I wasn't in my right frame of mind at the time. Whenever I went in, the doctor could barely examine me because I was in so much pain. So eventually it calmed down a bit and was still crying and stuff with the pain, but they were able to examine me a wee bit, and whenever they examined me, they said that I had genital herpes. I was obviously devastated, and it was just every emotion I felt, and none of them were good. It wasn't that I was proud or happy, it was all sad, embarrassed and ashamed. I had to take 2 tablets every day for 2 weeks. Now, people usually only get 2 tablets every day for 5 days, but because my case was so bad, they felt that they needed to give me the 2 weeks. Nobody even mentioned condoms. Even my group of friends never even would have thought about sexually transmitted diseases. They thought that they were fine because maybe they were on the pills, so they didn't get pregnant. With the sexually transmitted disease that I got, it'll be with me for the rest of my life. I'll not always have it, and I'll not always have an outbreak of it, but it's something that can lie dormant in my system and will be with me till the day I die. Whenever I'm an old woman and I'm old and wrinkly, it will still be with me.
Carol Emerson has been a consultant in the Gum Clinic for just 2 years. One of her roles is reaching out to the gay community during Pride and visiting gay sex saunas in Belfast.
Gay Pride was really busy this year. It was lots of fun. I mean, people were very open to talking about things. Really, the numbers that came to see us was just superb. Yeah, I hardly stopped actually for 2.5 hours. The work I do in the outreach clinics is really to reach a group of high-risk men who wouldn't ordinarily attend our service for reasons of stigma or fear of judgment, and you know, all of those types of reasons. The way it operates, we're in a separated off area in the venue, and the Rainbow sexual health worker will usually bring the clients to us.
Are you in a relationship at the minute?
Do a lot of one-night stands.
Okay. And so when did you last have sex?
Last night.
And was that with a regular partner or a casual partner?
No, casual partner.
Casual. Male or female?
Female. I'm a transgendered lesbian.
And have you ever had a HIV test?
No.
A lot of the men that we see have never had a HIV test before, have never had a sexual health checkup.
So I can do a blood test today that will check for HIV, syphilis and hepatitis B and C. Are you happy enough to have that test?
Yep.
Actually, I was just looking at the numbers yesterday, and almost 50% of the men that we've seen so far have never had a HIV test before. And really, that is what drives me on to keep doing it, because it's such a shocking figure to me.
Is disease such as HIV still a potentially fatal disease? The answer is yes. Okay, if you look at statistics of HIV in Northern Ireland, a certain proportion of people will still suffer from fatality as a result of HIV. However, it is important to focus on that these fatalities tend to occur in people that are diagnosed too late. Okay.
Sequoia also specialises in HIV. The most recent Northern Ireland statistics show the majority of new HIV infections came through heterosexual contact, rather than men having sex with men.
If people are picked up early, and we can address their monitoring and address their treatment early enough, then actually most patients that have HIV these days should really have near normal life prognosis.
Can I just get you a wee plaster for that now?
Okay.
I don't want you to bruise.
When I was a male, I didn't bruise. Now I'm a female, I bruise all the time, but sure.
HIV is probably still one of the most stigmatizing diseases that we have. If people aren't talking about it and addressing the matters, people are probably more likely to be in denial of it, and hence they themselves might then say, oh nah, I'm not going to be at risk of it, so why bother go and check?
Most people don't expect it, and you know, they don't think about it. They take the tests and they don't necessarily think that anything is going to show up. And I mean, there's a whole spectrum of responses. Some people respond in a very sort of measured way, and some people are absolutely floored by it. And you know, in those cases, it's really important that we have our links with mental health and psychology and have counselling, you know, and all of those things in. So that can be very, very difficult.
Raymond Moore visits Paris several times a year. It's a city he loves. And it's a city with a fascinating history in relation to sexually transmitted infections. There was a time when 1/5 of the population were reckoned to have syphilis. Paris has a reputation as the city of lovers and of openness about sex. It's also the city responsible for some of the earliest research into sexually transmitted infections.
At the beginning of the 19th century, French medicine was probably the most advanced in all sorts of fields in the world. In terms of sexually transmitted disease, the big disease, of course, was syphilis. And syphilis had swept the world from the 15th century on. And many of the leading experts in syphilology were in Paris. It's actually quite remarkable, isn't it? You walk in here and see this vast array of every sort of deformity of the human body on the outside. It's an Aladdin's cave for medical people, certainly, and I think for someone like yourself walking in here, it really must be a shock. This was a collection which was started in the late 19th century, and it was in an effort to go a step beyond the drawings or the paintings that were made in those days. So they set about making casts of any skin disorder. Then the cast was filled with wax, and the wax impression gave an exact outline of what the patient was suffering from. And it really is quite remarkable. It's just actually like looking at a real life person's problem. And you know, it's actually quite exciting coming in here for someone like myself. Thank goodness, this really is history, and this is the history of medicine. This is the syphilis section. This is a very renowned collection, probably nothing like it anywhere in the world. And it is showing the 3 stages of syphilis. Syphilis is a disease caused by a bacterium called the Treponema pallidum, and it first of all infects the genitals, usually by direct contact, and it results in what's called the primary stage, which is usually an ulcer called a chancre, and that occurs 9 to 90 days, usually after the person has acquired the disease. This disease continued for the next 5 centuries as one of the major killers in the world. And for example, in the 19th century, it was estimated that in the population of Paris, about 20% of adults had syphilis. It was estimated that in London, at least 10% had. And this was a common phenomenon throughout the world. A colleague actually made an interesting observation recently. People do Google researches of their family trees now, and he made the observation, well, it wouldn't be too many generations before everyone had a relative who had syphilis, a couple of generations back from the statistics. So it's interesting to think of things like that. One particularly nasty manifestation can be the involvement of cartilage and bone, And we see here someone who's basically their nose has disappeared, their cartilage has been eaten away by the disease, and this results in horrible deformities. I mean, I actually remember vividly as a medical student going to what was called a special clinic in those days, and seeing a man who seemed to appear every day, who sat in the waiting room, and basically his whole nose had disappeared. There was a hole in his face, and this was due to late syphilis. And of course, in those days, nothing could be done. The disease could be arrested, but because the destruction had been caused, that couldn't be reversed. I sometimes thought he was there as a sort of warning to the other patients. So you can divide the world up into the developed world and the developing world. And in the developing world, you'll see everything that you'll see in this museum today.
Attitudes to sexual health are slowly changing. Raymond and his colleagues are delighted that more people are coming for precautionary checkups, seeing it as a responsible thing to do.
I go about every 6 months or so, just as sort of status quo, either prompted by just the fact that it seems like a good idea, or by starting seeing somebody who wants both of us to go along and sort of get a clean slate before the start of a relationship.
I was first diagnosed with diabetes when I was 15, and came up when I had a urinary tract infection. I wasn't sexually active or anything at the time, and then later on, it happened to me again. I went to the toilet and I was passing blood, and I was like going, oh dear. So I went to doctors. Doctors gave me a letter of reference.
Well, the reason for being there in the first place was girlfriend had a cut in her vagina, which turned to be very painful. She went, got checked out, turned out to be herpes. Obviously, she thought I'd give her and whatever, so I went and got checked out to be safe on it.
It opens really early, and I think the opening times are quite funny because you could sort of nip in there and nip out without meeting all the tribes going to work.
Inside the actual place at the time, it's nerve-wracking. On arrival and waiting in that queue, my dick shriveled the size the day I was born, which was frightening. But see, to get the okay at the end is unbelievable.
The cold sweats running down me, and lo and behold, there was a beautiful student nurse saying, do you mind if I sit in there? I was like, no, not at all, just give you an examination. And I'm sitting there going, oh dear, oh dear. So I'm sitting there bright red, totally embarrassed, and for no real reason at all.
Raymond Maw's been involved in setting up a new clinic in Downpatrick to complement others in Derry, Coleraine and Newry.
So that the people with symptoms and the people who are contacts of infections definitely get in when they need to get in.
The senior nurse there, with a PhD in STIs, used to work with him in the Royal.
We've decided to call it a sexual health clinic rather than a GU clinic because we're trying to be a bit more open and positive about sexual health. Anyone who uses the New Down Hospital uses this system, which is called Savience. So essentially, when patients come in for their appointment, they touch the screen and they're essentially asked to enter their date of birth. So the screen's asking us, are we happy to proceed? Am I female? I am. Well, I think you have to look at the infections that we're seeing the increase in. And we're seeing them in chlamydia, syphilis and HIV. And then you have to look at who are those occurring amongst. So chlamydia is an infection particularly of young people. And so you look at their behaviour and you see that they're having sex at a much younger age, they're having more sexual partners, and they're changing their partners more frequently, which is allowing chlamydia to spread. So that's why it's important that clinics like ours exist, so that we can get them treated quickly and get their partners treated. So a little slip of paper will come out and it has a call number. And then throughout the outpatients there are television screens, and whenever I activate the Savience, the number will come up and she'll be told which room to come to. So we use no names at all.
Over 3 decades, Raymond Maw has seen a massive increase in infections and in patient numbers. Yet Northern Ireland remains by far the worst funded gum unit in the UK. Despite this, he's also been at the centre of every new development in the treatment of STIs.
Well, on the very most basic level, I can recall quite a number of cases of people who have actually sat at home, cut themselves off from socialisation, not form relationships because of, say, some incident that had happened 10, 20 years ago. And when they come to us, they finally picked up the courage to do that, and they say, why didn't I come sooner? That has changed my life. Herpes was portrayed as something that was an incurable disease and you could transmit to other people. The big landmark there was the development of the first really effective antiviral therapy called acyclovir, on which all subsequent antivirals have been modelled, that type of approach. So that was a big landmark. Your patient attended our HIV clinic today. They continue to be in good health and the virus is totally suppressed. On the other extreme, of course, is the HIV disease. And HIV can mimic nearly any disease. There's all sorts of manifestations. And what was so depressing was seeing people presenting sometime later, disease manifestation coming on. We couldn't do much about it. And they were literally on a conveyor belt to death, in some cases horrific deaths. I've seen some really horrible deaths with HIV. And the greatest thing that has happened in my career is undoubtedly that we just don't see that now. The transmission of HIV from mother to child would have been in Europe around about 14%, right up to 30% in some communities in Africa. All women now are screened for HIV in the United Kingdom. If they're found to have HIV, they will be put onto treatment during pregnancy, and that has resulted from going, say, from 1 in 5 to 1 in 10 children being infected to probably less than 1 in 1,000 now. That's an amazing achievement.
As Raymond prepares to retire from the NHS, some things haven't changed since he started his career in 1976. He gives the same advice today that he gave then. Be selective in your partners. Don't let alcohol cloud your judgment. And never have unprotected sex with anyone other than your regular partner.
My advice would be always wear a condom. No matter what, always wear a condom. A guy or a girl might smell nice, they might dress nice, but it doesn't mean that they're clean. A lot of sexually transmitted diseases you can't see, they're not visible. I think that you should always be careful because I wouldn't wish what happened to me on anybody.
You have to start at the beginning, and people need to be educated. Be as open as possible with your children from a very early age and encourage them to talk to you about these matters.